Should we start with the fall on the health fair for May 18th?
Sounds like a plan, Diana.
Let's go for it then. May 18th. What do we think about May 18th and having a table and joining the health fair? And what kind of resources do we think would be appropriate? I think we had a table, right, last year. I know Heather and Mark were manning the table. I know also Brentley came and did it too for a little bit. Hello? Hello? Hello?
I can hear you.
you.
Sorry, I just joined.
Did everyone hear me?
Yeah.
I can hear you. Can you hear me?
Yes.
Okay.
Yeah, I think May 18th sounds good because we don't want to recreate the wheel. So if that's the date of the health fair that they're already having, then we could do the same thing we did last year, correct?
I think that's a great way for us to continue what we started last year, but I want to know if we have enough manpower to man the table.
I would definitely say that you guys need volunteers. And it doesn't just have to be from this committee. You could ask for volunteers from other folks as well. If people are interested in manning a table at the health fair, that would be for sure. Because Christine and I were working today on the schedule for the street fairs that we're going to be doing this year between Night Out and then some of the other street fairs this year. So we could definitely reach out to other board members if you guys would like that. Christine is going to be doing that in the next couple of days, so you could let her know that.
Yeah, I think that's
and she could add that to the list. But we definitely need we definitely need volunteers because at least this year it won't be on Greek Easter weekend. Last year that was kind of nuts and it was crappy weather. So let's hope it's better weather this year.
It was raining, it was cold, and we were outside instead of indoors.
Mm-hmm.
So I really think that would be a great idea for us to then follow up with Christine and see if we could partner up with or tag along with get some volunteers from other community boards.
Right. Are you the chairs going to be able to attend that?
Yeah, I'd like to be able to attend it for at least an hour or so.
Okay.
Anybody else?
Yes, and I can put an hour or so on my calendar right now. Do we know what time the health fair is?
Usually starts at 10 a.m. and I believe it ends around 1:30. It's usually at the Regal Park Center. Do we have a flyer for that yet?
From Heidi?
Yeah.
Probably not because it's like not even April and that's in May. Let me do a quick search of my email just to see.
I'm so sorry. I joined late. Can somebody just let me know what the health fair is on the 18th, like who's organizing it?
So Heidi Chain, the 112 precinct, is basically doing that together where they every year put together the health fair where there's other organizations, also the police precinct, obviously, other like Northwell Health. So everyone basically, all the vendors get a table and come out there to provide handouts, swag items, really kind of like an awareness.
Mark, you're muted.
Yeah. So Ava, I was there last year and it was useful because that part of the community, it's usually in Regal Park by that Regal Park Mall. That part of the community really doesn't have much contact with the community board. So us being there, I think, was a great opportunity to educate them about what the community board does. So I think it would be great if we get a couple volunteers who can staff it.
And then are we allowed to invite other organizations to table or what was, I feel like there was a second piece of it.
Yeah, Heidi did say that you could invite others if you know other organizations that want to come and also, get a table.
do we want to use that resource list that you guys just created, Mark and Diana, to think if there's anybody on that list that we would want to invite?
We could definitely look at it.
Heather, I think you're on mute now.
Thank you, Mark. If we would just reach out to Heidi and see you know, who she's inviting, so that we make sure that we're not doing double duty. Because we may be inviting somebody that she may have extended an invite to.
Yeah. That's what she always says, send me an email of who it is that you want to invite. So this way she knows and she could cross it off our list in case. And this way Heidi is in the loop.
Yeah, that works out great.
And who will be reaching out to Heidi?
If you guys could submit the list of once you guys have determined who we would like to include, along with contact information, we can have Christine, we send it to the office, and then Christine can make the connection.
But Kendra, do you guys think of anyone that you'd like to add to the list or that you have in particular in mind? I think you guys would do a great to put something together in terms of who you think would be a good idea. And I definitely want to go over then the resource list as well, to see if there's anyone there. Like I said, we can send it to Heidi to make sure that she's in the loop. What do you guys think?
Yeah, I mean, keep in mind that Heidi will now be moving from being board member to being just a member of the community we work with. So it will be just a wee bit different moving forward. Just keep that in the back of our minds.
Yeah,
Perfect.
I'm happy to take a look at the list of folks who are invited and think about if there's anybody missing that we should include.
The other thing I'm thinking about is the next two items on the agenda, the DV education series, as well as the resource list.
Yeah.
If we can kind of begin to finalize these things, and if it's ready by May 18th, maybe we could actually have information about it and distribute it. And that could be something that we could do that's unique to any other table.
Yeah, I love that idea, Mark.
Mm-hmm. So I want to talk about, Ava, what you also brought into the email not too long ago, discussing Safe Horizons, right?
Yeah.
What do you
Yeah,
think
so
about
I got a new job. I'm working at Safe Horizon now, which just so happens to be the community's largest domestic violence nonprofit. So I did talk to somebody briefly who's the head of our community programs, and I mentioned that we were looking to organize something on this topic, and there's somebody from her team that I think she was said that she'd be willing to connect us with. I don't have a lot of details beyond that. Like I would have to reach out to the person and get connected with the right person at Safe Horizon because I work in the fundraising department. I'm not the one organizing these events, but I could talk to somebody who would know, and then try and get us connected.
That'd be great.
That would be great, Ava. Just to remind people, when we first started talking about this series, we were going to model it a little bit after the intergenerational series, because we realized that to do a DV series, we would need to partner. That we don't have the capacity to do it by ourselves. So the concept, just like we do the intergenerational, we reached out to other organizations or even other committees within the community board and also other organizations, and then they became co-sponsors with this. So we were kind of like the lead, but then we would work with other organizations. Like now with intergenerational, Common Point became one of our primary leads, and Faja from Common Point is now one of the people that's really leading the effort. So just putting it out there that if we're going to step into this, it would be great to have Safe Horizons. They're a wonderful resource, but we shouldn't just rely on Safe Horizons. We should think about partnering with other local organizations, and then we would organize, like we did with the intergenerational, a separate meeting from this committee to pull it together and begin to plan it. Because I think what we envisioned was not just a one-shot deal. We were planning to do a series, right, in terms of different types of presentations, because DV presents in many different ways. So
Right.
I just said a lot, but what do people think about those ideas?
I definitely want to start with Safe Horizons and see where it goes from there and kind of like pilot it. And I want to see how that kind of like rolls out before we then say we want to invite a few more people. Not to say that that's because I did also have a preliminary conversation with, let's say, for example, NILAG and also Shalom Task Force. So they also tackle different areas of DV. And I think it would be great to also have, them come in and provide their perspective on what they encounter and what they deal with and what they provide as resources.
So would you envision having them as part of the planning committee or having them kind of do the presentations?
You got cut off. Say that again. What was the second thing?
I said, want them like having this planning committee that I'm suggesting, or do you see them more as providing, being panelists, we'll have a panel discussion on DV and inviting them to be panelists?
I think we should start with inviting them over as panelists.
And are you looking for them to sort of just run it? Like come on and, just sort of do it like an agency consultation would come and give a presentation on, let's say, I don't know, the new bus queen, let's use the MTA because they come to us the most. So they come, they do a presentation on the new bus redesign. So is the expectation that that Safe Horizons would come on, pick a topic that's under their umbrella and come and do a presentation on it? We would then promote it to the community, let them know that on this given date, we're going to be doing this promotion. We're going to be having a presentation from Safe Horizons on this particular subject that deals with domestic violence. And that we would then, after the fact, we could record it and then post it up on YouTube. Is that what you're thinking?
I think that would be a perfect start.
Just to have them come in and just share their expertise. I think that's nice and easy. And I think it would be very beneficial. Because we could then email out to our distribution list this presentation. I think it's a great idea.
It just makes it, like you said, nice and easy. I think it's a perfect way for it to, get that information out there. And I think it's a perfect opportunity to create more connections.
Right.
Yeah, and I think the point of the board is to make that connection. How
Right.
did I come on as host? I'm gonna have to fix that, Mark. Is to make that connection so that we can, because I think sometimes we think that we have to be the experts. We just have to find the experts and connect the community to the experts. Because, I'll be 90 and still not know everything. So, I just think it's a great move. Yay, yay, yay. Perfect, perfect, perfect.
All right, so it
Yeah.
sounds like,
Ron?
Ava, if you don't mind speaking to the folks at Horizons
Yeah,
and
I can
let them
do
know
that.
that we're interested in maybe having a person that would be willing to come to us, and and we would highlight it and we would put it out there and we would tape it and share it.
Yeah, so I mentioned this to the person who runs all of Safe Horizons, like community engagement and their hotline and everything. And she said that, there was somebody internally that she could introduce us to. So, once I find who the correct person at Safe Horizon is, what's my next step? Who should I put them in touch with? Should I invite them to a meeting like this one, or?
If they're interested in doing that for us,
Mhm.
if you could email if you could make a connection between Kendra, Diana, and myself and Christine, then we can work on getting their information and doing it that way.
Right, okay. So I'll reach out to them and I'll basically let them know that I'm making a note to myself so I remember to do it because I don't remember anything if I don't write it down. Okay.
Girl, that's the way of life for a mama. And honey, I hate to tell you, but at 54, menopause brain is even like whack-a-doodle.
Yeah. That's
It doesn't
why
get
I have,
better.
yeah, I didn't, it's also an ADHD thing, so I got the double whammy.
Oh, yeah.
So, okay, so I'm asking my colleagues, I'm gonna let them know that, CB6 is interested in organizing a DV workshop, which they would promote in the community, and then I'll just ask who's the correct person, and then I'll loop them in. Loop in Heather, Diana, everybody on this call?
Well, yeah, why not? You know,
Or do
it's
you
a
want me to-
family affair.
All right.
They could include me. I don't mind.
Okay, I'll include everybody, and then I'll let you guys take it from there.
Awesome, Dawson.
Great.
Thank you, Ava.
Yeah, no problem.
This call is like super productive.
So back to that list now, that amazing list that I was playing around with, literally just, through some ideas that came to mind and put on paper. And obviously, Mark, you dived in even deeper and put together even a few more amazing resources in an email thread,
so-
which, by the way, I would love to go through and see if we can include that.
Right. So I'm going to share my screen. So this is the list that kind of Diana came up with. Can people see that? If it's small, you should be able to increase it on your screen. I think there should be like a little arrow, a little plus. You should be able to increase it on your screen. Sorry.
Wow.
So can people see it? So we got New York City Health and Hospitals, Queens. We've got Queens Hospital Center, Queens Counseling Service. And then we have therapists in Queens through Psychology Today. We have New York City Well. Then we have SAMHSA. Excuse me. There's the Community Healthcare Network. Then we've got Jamaica Hospital Center. And that's the list that Diana had put together.
So a lot of those locations have on-site, both behavioral and mental health care. Sometimes it's on emergency, sometimes it's obviously outpatient, especially those that are affiliated with the city.
Right. It looks like we don't have Northwell.
I
would think,
add Northwell in there? Oh my gosh,
yeah, how can we not have Northwell?
do that.
Yeah, so, all right. Can somebody make a note that we should add Northwell?
Yes.
So is it okay if I stop the share, because I'll share the resources that I added to this.
Yes.
Okay, so hold on. Stopping the share. And these are the resources that I added.
Heather, you're on mute.
Can you see it?
Yes.
So I added mental health single point of access. That's if you have mental health issues and you need either a case management service or you need help in locating housing. So that's called the single point of access. Then there's something called clubhouse programs, which I kind of defined here. And we have none in CB6, though I did find one in Elmhurst and one in Jamaica. And here I also gave as a link Clubhouse International. Then I talked about the next thing I listed is partial hospitalization programs. And I found one in Elmhurst Hospital. And then I also listed Northwell, which I know came up in one of our previous meetings. Northwell Health, their inpatient psych is at Zucker Hillside. So and I know some people had issues, they had to travel to Zucker, but that's unfortunately how they're set up. And then I ended with the Supportive Housing Network of New York, which I know Kendra's involved in. So those are the resources that I added. As you can see, more mental health oriented.
Yes, I like it. And I definitely think we should be adding that in there because that's important.
Okay, so again, I can combine the two. So how about
Kendra, what do you
instead
think?
of deciding that this is it, why don't I, if it's okay, I'll send it to Diane and Kendra, and you can send it to the rest of the committee. I'll put it in one list and share it with the rest of the committee and ask the rest of the committee if they have any additions that they want to add. And then if we want to try to get this ready by May 18th, we should try to set, like, my suggestion would be we set a date as to when people, a finalized date. And then once we share it with Heather and Christine, just to make sure that all the organizations are, none of that, because again, we can't promote a for-profit organization, not allowed, we're a city agency. So we'd have to make sure that none of them are for-profits. And then we could, maybe if we could have it ready by the 18th, maybe we can do it as a handout.
It should definitely be a handout. Sorry, Heather, go ahead.
No. Do we happen to have on that list? Remember when we met with a couple of these
Abuse programs. There were 2 of them.
yes. Are they on the list?
No, they're not, but I think both of them weren't both of them for profits.
Emmanuel's is for profit.
One was a for profit.
Emmanuel's is for profit.
Okay.
And the other one was not for profit, I believe. No, it was for profit. Mark, you're right, it was for profit.
So yeah, one was for profit, but I think one was not for profit.
Okay.
Yeah.
I can't remember which.
Okay.
The one here in Regal Park, definitely. The one from Emmanuel was definitely for profit. That I remember for sure. The one that we met before that, I believe, was a woman.
I think she was also for profit.
They were
I think they're both for profits.
I think so, yes.
So Heather, would we list for profits?
I mean, I'd prefer not for profits just because it looks like we're promoting a business and that's not what we do.
Right.
We're very careful to never do that. So no.
Yeah, okay.
I also wonder if there's any like either city, state, federal, whatever resources that have like a directory in them that we could link to. Because I know that, like, for instance, I don't know how it is for mental health care. I know that, like, for, when I was looking for childcare, I could just go to the city directory of registered childcare agencies. Is there something like that that exists for mental health? Watch, I'm going to be disappointed that there isn't. But
Technically, the New York City Department of Mental Health should be that resource. But maybe this is something we can ask Christine, Heather, in terms of if there's like a contact. Don't we have somebody who comes to the cabinet meeting from City Department of Mental Health?
I think so. Trying to remember who that is.
Right. So what I'm thinking is, as Ava suggested, maybe we can have her we could ask Christine to reach out to that person and say, hey, we're putting together this, we'd like to have as comprehensive a mental health list as possible. Can they provide us a contact that we can then list as public facing and that we can put out there?
Public facing from the Department of Health?
Correct.
Okay. Yeah. Let me put that in my calendar for the cabinet meeting.
Yeah,
That's coming up this week.
ask if they can. Because I would think that would be the go-to.
Yeah.
Is it the city? It's Department of Health, Mental Health. It's the City Department of Health also covers mental health and substance abuse, right? Am I getting that right?
I believe so. And I'm going to take back what I said. My service cabinet meeting isn't till next week. Okay. So public facing.
Contact, that we're putting together a list of mental health resources, and we would like, to list the City Department of Mental Health as a place for the public to call if they have a question about a mental health provider.
Yep. Okay. Got it in there.
I mean, New York City Well is like the center central call if you want to like a clinic, but I guess
Yeah.
broader, but New York City Well mainly focused on mental health.
Okay.
City Well is listed in that resource directory, but maybe Heather, if you could let them know that we are listing New York City Well. If that's what they're going to give you, then we have that already.
Okay. Got it.
Not to like try and make us jealous, but I was looking up mental health directories and I saw that Manhattan Community Board 3 had made like this fancy PDF of mental health resources in their community where it looks like they
Share
conducted
with
some
us.
kind
It
of a
doesn't
survey.
hurt to have that as a model. Maybe we can model after it.
Yeah,
Yeah,
I'll
can
put
you
it
put
in
the
the
link in the chat?
yes, of course.
Please, thank you,
Where is
Ava.
that? Yeah.
Also remember, some of these boards in Manhattan and other places, just as a note, sometimes their board members pay for certain things, because sometimes like their websites are sexier than ours, so it's not because they have more of a budget. All community boards have the same budget. It's just a matter of, other things. So thank you for that. I'll click on it, probably get main jelly. Survey results.
Yeah, I was thinking it looks like they did a survey of all the organizations that provide mental health. Because then, yeah, they put them all in a little map, and then I guess they must have surveyed them about what types of services they offer.
Yeah. I appreciate, and I do think when we publish this, we do need to consider adding a date, because as we're well aware, things do change. And so we may want to just have this in the cycle that once a year, this committee just revisits that list, make sure that it's updated and accurate, because things do have a habit of changing.
Yes.
It's like, for example, Northwell is going to be moving its urgent care on Queens Boulevard, further down Queens Boulevard into the old Trilon building, for example. So they changed locations. And so I just think it's good for us to just keep these updated. And considering that our community seems to be healthcare central, it just seems like every time I turn around, there's a new healthcare business opening up. I honestly, I'll be honest with you, I wish there was more health and hospital stuff in our district as opposed to just all of this private, because I feel like we have pockets of our community that could really benefit from health and hospitals and not having to travel all the way to Elmhurst or all the way out to Jamaica. I mean, Queens Hospital is fine, but it's definitely not convenient to get to. I mean, you literally have to Uber if you don't have a car. It's not public transit friendly. It's car to a bus. And usually when it's a two-parter, a two-part of the system, it's just, I just wish there was more of an investment here by the public hospitals. But who knows?
Right. Well, the other point too that was brought up at that meeting a few months ago, is that we don't really have an inpatient psychiatric facility that's close by. I mean, I think aside from the one in Northwell, maybe, I don't know if Elmhurst has inpatient. I don't think does Queens Hospital have inpatient?
I don't pretend to be an expert on this, so if
Yeah, I'm
any
trying
answer
to,
I'd give you would be a lie.
yeah, I'm asking other. So that's another challenge, right? In terms of if you need an inpatient. Because the point that was made, I remember Pat Morgan made it, and I think other people made it too, that if you have a loved one who lives in this community and they get hospitalized, inpatient psychiatric hospitalization, and if they have family members have difficulty traveling, it's hard to get to visit them. And we know when you're in a hospital, visitors are very important.
I'm here with you. I've just got my daughter over here giving me some extra work for my tippy toes. As a, I'm sorry, Mark. I'm not responding. I'm just trying to keep her from I don't know, climbing the next cabinet up here. Stop. Thank you.
I would flatten this.
Okay, so let's get off the counter. Okay, can you get off the counter? Thank you. Sorry about that, guys. I absolutely love the idea of having this this list, this resource list. I think this would be a wonderful way for us to also come together for the community to let them know that we are putting in the time to, you know, get them the resources they need to have at their fingertips. Many times people don't know where to look, and you know, when you start to panic, and having that at hand, I think like pasting it up somewhere that so people can see it is an amazing effect.
So Mark, are you going to send us the updated list so we can send out to the whole subcommittee for feedback?
Yes, I'll
Okay.
do. I'll commit to doing it. I'll put it all in. I'll put the resources that I provided, and I'll add. I think I'll remember because I think we're not only missing Northwell, we're also missing Mount Sinai. I think all 4 major hospitals have some type of outpatient presence in our community. I think Northwell has. I think Sinai has. I think New York Presbyterian has, and I'm missing one. Heather, you're on mute again.
NYU.
And NYU. So right, so all 4 major hospital networks have a presence here. So I'll add each one of those, okay? And of course, I'll add Northwell as the 5th one. But yeah, Kendra, I'll commit to putting that all on one list and then sending it. I'll send it to you and Diana, and if you could circulate it to the committee, that would be great.
Mark, will do.
And then again, I would suggest we put, I don't know, put a deadline in terms of, you know, you want to have it ready, April 15th. It's
Well,
just
I
tacked.
definitely want to have it before Passover. Can we aim for that?
Yeah. When's Passover, hun?
It's coming around the corner. I'll tell you that much, and I can't catch my breath. It's April.
It's,
Yeah,
it's,
so we
it's,
could
a, it's a week and a half before April 20th, right?
Yes.
Yeah.
Right.
Yeah, it
Oh,
starts
yeah,
on the
if
evening of
Mark,
the
if you
12th.
get us this, when do you think you could get it to us by so we could distribute?
Right. So I would say, again, by sometime in April.
No. When would you be able to get us this by like the end of this week or?
Yeah, I'll be able to get it out by the end of the week.
Yeah, and then that would give, if we send it out this weekend, that would give enough time before that week and a half before April 20th.
Right.
Yeah.
To look at that date.
Yeah, and Heather, I'll CC you and Christine so you can see it as well. And if Christine, if she has any suggestions, it'd be great if she can add.
Yes.
Does anyone have anything else they'd like to add?
Yes, priorities.
Oh, yeah.
You know, I was going to say budget priorities, right?
Of course, I
So-
was waiting, Mark.
So this committee submitted budget priorities last year, and at April 1st, we're going to be, well, this next board meeting, we're going to be kicking off the process for the full board. We had a chairs meeting a few weeks ago, and then we're going to start the process. So between now and June 30th, this committee is going to have to meet at least once to review the budget priorities and decide which ones we're going to recommend. So based on that, I guess I'll call, when do you want to schedule our next meeting? Given it's probably, if we do it now, we have a better chance of getting a date that we want versus if we wait. Because we know that starting April, the calendars can get really booked up because all the committees are meeting to do budget priorities.
When did you say it was again, the deadline? Sheesh.
The last business day of June.
Right, okay. Again, we want to do this before Passover, I'm assuming, right, Mark?
No,
How
Okay.
about we do it the end of April, like after Passover? I would love to do it the end of April.
I'm great at the end.
Yeah, we could do it after Passover.
Thank God. Let's do that, please.
Yeah, let's shoot for the end of April or beginning of May because depending on what, I'm not for sure how many folks already have dates with Christine, you know, for April. So maybe that last week of April, first week of May, we could do either Monday, Tuesday again, 7 o'clock and see if she has openings.
yeah,
Perfect.
And I'd hop as soon as you can, because eventually people are going to start to figure this out. And you're the second person that I have talked to this past 2 weeks about getting a date and wanting to do that. So please hop and get first dibs, because right now nobody has asked. The only
Yep,
thing
I'm
we
gonna
have
send
is,
it, I'm gonna send it, the email to you guys right tonight when I send the report.
yeah, because
Thank you,
So
Ken.
what date did we say? April 29th? That's a Tuesday. It's after Passover.
April 29th or the following Tuesday.
Or the
if
following,
that
you
would-
want to do May 6th?
May 6th, if that April 29th is booked already. You know, I just like to always give Christine at least 2 dates.
Right. Okay.
If we could do May 6th, preferably just because it's my mom's birthday, the 29th. Just saying.
Aw.
Yeah, we could do May 6th. Does May 6th work with you, Mark? And I'll send the email to Christine.
Yeah, May 6th works.
And that will be for our subcommittee budget meeting.
That, yeah. And then, of course, if there's anything else we want to discuss, we can do it. But it's probably best to keep that, make it simple.
Let me see.
And, you know, maybe we could, at that point too, we can have some updates about the health fair.
There's nothing right now on the 6th. I just checked.
Perfect.
Okay.
Yeah.
So why don't we take the 6th?
I'll email her right now.
Okay.
So also maybe we could get updates about the health fair. We can hopefully begin to finalize because that'll be before the 18th, right? So maybe we can use that. We could do budget priorities and do the follow-up on the health fair, education series, all the things that we talked about now. Why not?
Mhm.
Anything else?
That would be my daughter playing with the aluminum bowls for background music, you know, just in case. I think we covered everything that we had on the agenda and obviously what we needed to. Thank you, Mark, Kendra, and Ava and Heather. Thank you all. If there's anyone who has anything else they want to add, please.
Not that I could think of, not at this point in time. I will just say that we will be getting new board members in April, and we will be encouraging people to attend board meeting, committee meetings to start to get a hang for things. So maybe you'll have a few new faces in your next meeting in May, which would be good. I actually know that this committee is small, but I actually like how this committee thinks about things and approaches things. So I'm hoping people will attend this. So that's the only thing that I have new is for us to be thinking about, is just that we'll have some brand new faces in our room in a month from now.
Right. And also we have, weren't the two members, it wasn't Bradley and, weren't there a few people who are members of the committee that didn't show tonight? So maybe it would hurt to follow up with them and let them know.
Yeah. Kendra, if you want to, you can take your committee report. That would be something to do that kind of loop them in, is to just send it to your committee members who weren't able to make it tonight and just say, hey, here's what we covered tonight. You know, don't write anything extra. Your reports are thorough. Just say, here's the report we're submitting. Just wanted to share this with you since you missed our meeting tonight. Just make a note, our next meeting is. This
Gotcha.
way.
And where can I find the new list of committee members, or it hasn't changed, right? It's still
It
the
hasn't
same?
changed.
Okay, okay.
You won't have new committees until
May,
we
right?
do that over the summer.
Oh, okay, gotcha, over the summer.
Yeah.
All right, wonderful.
Yeah, because we used to do it like right when people joined, and I was like, it doesn't give people time to get to know these committees. And I think it's important that people can shop the committees, and some people take us up on it, some people don't, you know, but I just think it gives them an opportunity to kind of feel it out before we like ask them to pick something. You know what I mean?
Yep, absolutely.
It's like going to a buffet and you've never tried any of the food before, so you don't know what to put on your plate.
A la carte.
Yeah, exactly. All right, this was good. You guys were like nice and concise. It's like a 47-minute meeting.
Bye bye. Sorry, I want to go tuck